Jose, you can start in 5 seconds.
Okay, good evening and welcome to the NYC Health and Hospitals Fiscal Year 2021 virtual annual public meeting for the Borough of Queens. Before we start the formal program, I would like to call to your attention that we have interpretation services. If you require these services, please call 212-788-3359, and they're in Spanish, Mandarin, and Bengali. Thank you. So my name is Jose Pagan. I'm chairperson of the Board of Directors. I want to thank you for joining us. I would like to introduce the other board members who are here tonight. Dr. Vincent Calamillas, City Council Representative for Staten Island. Robert Nolan, City Council Representative for the Bronx. Benioski Peña Mora, Rita Wang, Sally Hernandez Piñero, Dr. Michelle Morse, representing Dr. Dave Shoxi, Philip Waddle, representing Deputy Mayor Melanie Hartsock, and Dr. Mitch Katz, President and CEO of Health and Hospitals. Also on the panel are Andrea Cohen, Senior Vice President and Interim General Counsel and moderator for the evening, and Colicia Hercules, Secretary of the Corporation. On behalf of the board, I would like to extend our thanks and acknowledge the leadership of our Queens facilities. Helen Arteaga Landaverde, NYC H&H Elmhurst, and Neil Moore at Queens Hospital, and the dedicated staff for providing exemplary service to our public health system and the people that we serve. And to all of you here, thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. Now you will hear from our President and CEO, Mitchell Katz, who will go next by his remarks. Thanks.
Thank you so much, Mr. Chair. We appreciate it. Sitting here watching New York City reopen, it's easy to forget that it was just a little over a year that our system was in crisis, with our ICUs tripled in size, 970 patients on ventilators, almost 4,000 COVID patients spread around among our 11 hospitals. But Health and Hospitals stood firm. We never turned away a patient. We were even able to take care of patients from other hospitals. Our heroes and sheroes made sure that our patients were all well cared for. It was a difficult time. We lost very much loved staff members. We lost patients. We lost family members. But I think we can have tremendous pride in how well Health and Hospitals did, and pride in New York City for maintaining a strong public hospital system. I think that the COVID pandemic proved just how valuable it is to be able to have a public hospital system. In the last year, our emergency departments managed more than 111,000 COVID patients and more than 55,000 who were hospitalized and then safely discharged. Thanks to our Helping Healers program, we supported our staff with peer counseling, respite rooms, and a range of mental health services to help them endure and prevail. And with more than $35 million, thanks to the amazing generosity of New Yorkers and those beyond New Yorkers, from so many supporters, we were able to offer our staff free meals, transportation, clean scrubs, hotel accommodations, and childcare to ease their difficult days. We then, Health and Hospitals, with our sister agency, the Department of Health and Mental Hygiene, launched the Test and Trace Corps, which became the largest and most successful test and trace corps in the nation, prevented thousands of infections by helping people to learn their status, to safely isolate, including in our 5 hotels. We then moved to vaccination, where we're doing vaccinations at all 11 of our hospitals, all of our outpatient clinics, and T2, the testing initiative that we run, is working side by side with Department of Health and Mental Hygiene also doing vaccinations. We are putting effort into taking care of patients as well who are long haulers, who remain symptomatic despite having gotten over their initial illness. I want to thank the Borough President of Queens for acknowledging the amazing hard work that was done at Elmhurst by contributing $5 million toward new structures at Elmhurst Hospital, recognizing that that hospital stood firm in the epicenter of Queens. With that, I want to thank you all for being here tonight and for supporting our essential public health care system. We want to proceed to the main purpose of tonight's meeting, which is to hear from all of you about your views of our system and how we can be even better in the future. With that, I'm going to turn to our General Counsel, Andy Cohen, to outline the proceeding for the rest of the meeting. Thank you.
Great. Thank you so much, Dr. Katz. And good evening, ladies and gentlemen. Before I jump into the rules of the road for our proceeding this evening, I just wanted to remind anyone who's joined us in the last few minutes, or those of you who just didn't remember, that there are translation services available. If you call 212-788-3359, they're available in Spanish, Bengali, and Mandarin. So welcome to everyone tonight. As you know, because of COVID-19 public gathering restrictions, which continue just for a bit longer, we hope, we're convening the 2021 public hearing for the Borough of Queens virtually. This is the third in a series of 5 meetings that we conduct annually across the city's 5 boroughs. The purpose of the annual meeting, as Dr. Katz said, is to inform the public on the programs and plans of New York City Health and Hospitals, and most importantly, to give the public an opportunity to present on their perspectives on New York City Health and Hospitals' performance and its reach. Public testimony will be taken tonight, oral and written, and it will all be transcribed and forwarded to every member of the New York City Health and Hospitals Board of Directors for their consideration. And ultimately, there will be a summary of your comments and responses posted on the New York City Health and Hospitals website. You can still register to testify this evening if you'd like to. You can call before 6:30, and again, call the same number, 212-788-3359. So in terms of the rules of tonight's engagement, the most important thing to understand is that the Board of Directors is here to listen to you at this point in the program and not to engage in a dialogue. So they will be listening but not engaging and not answering questions if any are posed. Again, a summary of everything you say will be put on the website of New York City Health and Hospitals ultimately, but for tonight, it's not a question and answer forum. So every registered speaker will be allotted 5 minutes of speaking time. On your screen, probably in a corner, you'll see an electronic timer that will provide warnings about the expiration of your time. It will start out as green. A yellow light will appear when you have 2 minutes remaining in your allotted time. It will turn red when your time has elapsed, and about 10 seconds later, it will start to flash. And at that point, I will interrupt you and ask you to please conclude your remarks as quickly as possible. If you don't finish your comments, don't worry. If you want to write the remainder of your statement or you have a written statement, you can submit the entire thing. Again, the Board of Directors will review the entire series of comments. I will be calling out the names of those of you who have registered to speak. And again, you have a few more minutes to register if you have not already. If I mispronounce your name, please do say so at the beginning of your time. Let us know the proper pronunciation of your names. Thank you so much, and we really look forward to hearing what you have to say this evening. So our first speaker of the evening is Catalina Cruz, an assembly member with the New York State Assembly. Assembly Member Cruz. Okay. The Assembly member may be detained. We will come back. The second speaker is Council Member Daniel Drum from District 25. Okay. Again, we'll return to those speakers when they're available. But for right now, I'm going to call on Anthony Andrews, who is the chair of the Community Advisory Board for Queens Hospital.
Thank you very much. I'd just like to say thank you very much for allowing me to speak early. I do have another meeting with the borough president who has given millions of dollars to Queens Hospital also, in addition to Elmhurst this year. And I'm chairing the meeting, so I won't be able to stay very long, but I do have a number of our cab members who will be here. So I thank you very much for allowing me to speak early this meeting. I want to thank Dr. Katz, first of all. At this time last year, I had COVID and wasn't sure what was going to happen next. And Dr. Katz, Deborah Brown, the entire team at Queens Hospital, including our Dr. Dave Olson of the emergency room, did whatever they needed to do to make sure that I recovered fully from my bout with COVID and to make sure that I did not get any worse. And I want to thank you so much, Mitch, for your friendship and your leadership throughout the tough time that we had last year, and in particular, the tough time that I had personally when I had COVID. Grateful to have the opportunity to address the entire board, especially my good friends, Dr. Pagan, and my very good friend, Bob Nolan, and all the elected representatives that are here tonight and their representatives. I want to particularly thank, even though he's not here, Israel Roca, who was here last year, who was incredible during the time of COVID with both hospitals. And, you know, we would not have made it without his leadership and without the leadership at Queens Hospital of Dr. Pollard and, of course, our COO, Dean. They were fantastic. And, of course, if it wasn't for our nursing department, we would not have made it. It was very difficult. Coming out of COVID now, I think back to what we went through, and I'm thankful that we had such a strong community advisory board supportive of the administration and team. I've been a member of the community advisory board for 18 years, and I'm a consumer of the hospital also. Now that we have the vaccination, we have been trying to work on initiatives that would support our effort to make sure the message gets out about those who have vaccine hesitancy about the vaccine being safe. So we've created a vaccine ambassador initiative, and we tried to reach out to the hardest hit communities in Queens, and we've been very successful. We've gotten a number of influential people throughout the city who have come to Queens Hospital, gotten their vaccine, and made videos and gone on social media to let people know the vaccine is safe and that they don't need to be hesitant to trust the science. So that's done very well. In fact, as of the other day, we administered our 50,000th dose of the vaccine. It was given to a young man, 12 years old, Timothy Samuel, who was the son of Finney Samuel, who was a pharmacy at the hospital. And we publicized that also to show young people that the vaccine is safe. Recently, we also granted a huge donation by Mr. Harry Harrigan, a local businessman who came to Queens Hospital for his vaccination in February, and was so impressed by the kindness and professionalism and efficiency of the staff and the diversity of our staff that he decided to make a donation of $1 million. And that donation of $1 million is going to help fund new diabetes management services and update related equipment in the ophthalmology clinic, and also our examination rooms. He chose to do this on behalf of the people in our community who are disproportionately affected by diabetes, as many of you know. The fact is that many of our diabetic patients suffer from potentially blinding diabetic eye disease as part of their condition. And we've learned the best way to approach these patients is to treat their condition proactively. One of the ways to do this is by increasing the services in ophthalmology. And I think, well, we all think this is going to make an immeasurable difference in the lives of these patients. Another endeavor that we're working on is we're supporting two proposals in the House Appropriations Committee of the federal government for community project funding initiative that is dedicated to reducing healthcare disparities in the borough, providing residents with increased access to safe and affordable comprehensive healthcare. And I'm just going to really briefly discuss one of these, the outpatient dialysis center. We are thinking about something we'd like to do with the funding, create an outpatient dialysis center, which will give our patients access to chronic renal dialysis. This has been a very serious concern for us in our community, specifically in Queens, Southeast Queens. So given the high number of patients with renal complications and diabetes, we think this proposal is going to be very, very helpful to us. The overall goal is, of course, to provide high quality, timely, and patient-centered care to chronic care patient populations in a single site setting. We think this center will do that. You have the testimony on hand, and we'll have the testimony of some of other cabinet members who are here to present tonight. Thanks for the opportunity to address you this evening. I look forward to working with the board in the future.
Thank you so much for your comments. Our next speaker is Brent Weitzberg. He's the Deputy Chief of Staff for Queensborough President Donovan Richards.
Thank you so much. It's hard to follow Dr. Katz and Tony after they stole some of my thunder with the announcement of the millions upon millions of dollars we were very proud to invest in, as Borough President Donovan Richards is making healthcare a priority of his administration. And as the Borough President likes to say, putting the money where his mouth is. So thank you so much to Dr. Katz, the CAB, to Helen and her amazing leadership. And as was stated before, the Borough President had announced last week that more than $5 million towards a number of projects is going to be given to Elmhurst Hospital to expand access to critical care for thousands of families. And two of those projects that we like to highlight is expanding the intensive care unit at Elmhurst. The fact of the matter is that no family in Far Rockaway or Long Island City, for example, should have to travel more than 30 minutes by car or 90 minutes by public transportation to get to a city medical care center that they need. And this allocation addresses that problem in partnership with Elmhurst Hospital in order to feed the need. Second, we're going to be expanding 2 undersized operating rooms at Elmhurst Hospital into 2 full-sized, full-service operating rooms, meaning the hospital can offer more procedures while decreasing wait times for patients. Definitely a win-win in the mind of the borough president. And, that brings up a good point that we try to address here, looking at healthcare in a macro sense. COVID-19, and you're going to hear this statement a lot, Queens was the epicenter of the COVID-19 pandemic. We are so focused on that, and there is so much more to do on that because, although we were woefully unprepared as a society to help folks, the fine heroes and sheroes, as Dr. Katz had said, at Elmhurst Hospital and Queens Hospital and all of our Queens hospital campuses really help protect individuals. So not only looking at what we could do with COVID, but what we could do healthcare in a broad sense. But looping back to COVID and moving on to the critical need for vaccination sites to prevent further loss is a priority for Borough President Richards. And through his advocacy, we led the effort to demand reopening Citi Field as a vaccination site, for example. And now we are so pleased to see so many walk-up vaccine sites across Queens. And now individuals 12 and over, as we know, are eligible for the vaccine. But something that we must highlight is to open up sites that make geographical sense and continue a community-based approach. There are so many lives that have been lost, and we cannot waste any further time in getting the vaccine to those who need it most. For example, in the Black, Latinx, East Asian, South Asian, Indo-Caribbean, and immigrant communities, they were some of the hardest hit communities during this pandemic. And it's imperative that the city and our healthcare providers continue to work 24/7 to get the vaccine administered to those groups. Recently, according to the citywide immunization registry, there's something along the lines of 54% of Queens residents that have gotten at least one. That's the second highest in the city. But being the Queensites that we are, we want to be number one. Now, among those who identified their race or ethnicity, 63% are Asian, compared to 41% of white, compared to 39% of Latino, compared to 27% of Black individuals. And, you know, the borough president states this a lot, that we understand that overcoming historical mistrust of scientific and medical institutions on the part of communities of color is not an easy goal to achieve. And the deep disparities that COVID-19 revealed are shown in these percentages, that we must do more to show that the vaccine is safe, and to continue to work with the governor and the mayor's office and our healthcare partners to get to as many vaccination sites as possible. I know at Borough Hall, we've hosted a series of town halls, community town halls. I think we have I've had about 7 of them, expressing facts about the vaccine and answering any questions. But in a borough of nearly 2.4 million people, there's just 1.72 hospital beds per 1,000, one of the lowest, if not the lowest, in the city. And that can't continue. In 12 years, 4 of our hospitals have closed, removing more than 840 beds and thousands of medical professionals, and leaving communities such as Far Rockaway with even less access to health care. And as Borough President Richards says, to accept this as normal would be to accept that the 2.4 million lives here in Queens are not of equal value to those elsewhere. So, to address the COVID-19 pandemic, to address healthcare resources as a whole, we must continue to do more. We can't forget as to what had happened, and we must continue to invest and provide access and information regarding healthcare and healthcare resources as it relates to the COVID-19 vaccine and healthcare resources as a whole. And with that, we look forward to continuing our work with HHC, Dr. Katz, Helen, Elmhurst, all your staff, and thank you for your heroism and amazing work during this. Thank you.
Great, and thank you so much for your
Thank
comments.
you so much for your comments.
Our original speaker is now available. Let's welcome Assemblymember
Catalina Cruz.
Hi, can you guys hear me? There's a weird echo from the person who was speaking before, so my apologies. I am still in legislative session, so I escaped for a little bit and I have to go back. I wanted to stop by and say hello and thank you all for your commitment to our community hospital. One of the things that interestingly enough, I texted Etienne and said, what do you want me to highlight? And then when she tells me all the things, I'm like, oh, you just want me to tell everybody what I always tell them about how much I love Elmhurst Hospital and everything that the hospital has meant for our community, everything from the testing. And I'm sorry, I think someone is unmuted, so it sounds a little bit weird in the background. From their commitment to testing, to ensuring that everybody gets vaccinated. I've worked directly with them to increase access to some of our more marginalized community groups. I worked routinely with this group of nail salon workers at an organization called Adicar. And the minute that I called Elmhurst Hospital and said, can we get them a group appointment, if you will, because these are the type of community members who fear hospitals, who fear law enforcement, who fear anything with a uniform, even as nice as Elmhurst Hospital is, they had their fears and they accommodated them and they brought them in and made them feel at home and at ease about getting the vaccination. And on a personal note, when my mother ended up in their ER because of COVID, they took extremely good care of her. And from what I heard from my neighbors, it has nothing to do with the fact that she happened to be my mom, but everything to do with the fact that we have some of the most amazing hospital team, doctors, specialists, just folks who are completely committed to saving lives. And that's what it is. Everything from their mental health care services to teaming up with our office to get people tested, to get people vaccinated, to get people aware of the resources we've done. I think at this point, since COVID started, probably about half a dozen, if not closer to a dozen, different types of Zooms on the different types of services that they're offering, and not just around COVID, but making folks aware that the hospital was open again. You can come in and get your mammogram if that's what you wanted to do or needed to do. You can come in and get healthcare services for addiction if that's what you needed to do. So it is a place that many people have found a home. We are in awe, and I say we because I always work as a team. We are in awe of the work they do around the holidays for folks who don't necessarily have either big families or families here in this country, or who even lost people. You know, everything from their turkey drives to their toy drives to simply just being an extra member of the family. And I see Brent here, so please once again give my thank you to our borough president for his investment in the future of my neighbors. My neighbors are very important to me, and they're very important to Elmhurst Hospital, and we remain committed to working with them. I am now working with their team on allocating some additional funding. About a year and a half ago, we put in close to $300,000 for some additional equipment, and to many of us that sounds like a lot of money, but it's actually not, because one medical piece of it, a fancy medical piece of equipment, can cost that entire amount. So we're working on bringing in a couple of other pieces to the women's healthcare unit that needs some upgrading. And I am going to leave it at that, because I know you guys have a lot more things that you need to do. And unfortunately, like I said, I'm still in legislative session and trying to get that money for Queens and for our hospital. I hope everyone has a wonderful a wonderful day and a wonderful holiday, which is coming up this weekend. And thanks again to our hospital. And what I always say when I close, you want to be thankful for the work that our healthcare workers have been doing. Get vaccinated. It's the only way to really, truly be thankful for what they've done. Get vaccinated and get your family and your friends vaccinated.
Great, thank you very much. Our
Thank
next
you.
speaker
I have to
is-
get going now. Have a good one, everyone.
Thanks for taking the time. Henry Yam, Chief of Staff to New York City Council Member James Gennaro in District 24.
Hi, can everybody hear me?
Yes.
Yes.
Hi, good evening. I would just like to continue the trend of local elected officials bragging about how much money they're giving to the hospital. So I am proud to announce that our office will be fulfilling all of the health and hospital capital requests that we've received this year, which totals to just about $1 million. We hope this investment really reflects even a fraction of the gratitude that we feel towards the hospital and its staff. Over the last year, you've all truly shown what it means to be dedicated to the well-being of, not just our city, but really our communities, the things that make our city great. And as the host council member for the Queens Hospital Center, we are proud to stand with you and do whatever we can to help those, fighting on the front lines of this disease. We're all extremely excited that we're moving towards a positive trend, and hopefully we can see the light at the end of the tunnel. But we understand that the fight isn't over yet. So we're still here, and we're still active and ready to do whatever we can to assist. Thank you all for all the work that you've done and that you continue to do.
Great, thank you very much. The next speaker is Tom Gretsch. I hope I pronounced that correctly. President of the Queens Chamber of Commerce. Please correct me if I.
Thank you very, very much for the opportunity to speak. I'm just getting out of my car, so I'll make this brief and yield back my time to the chairman and to President Katz. Thank you for all you've done. We've used the word epicenter way too many times, unfortunately, over the last year, but we were. As the largest and oldest business association in Queens County, with over 1,400 members representing 125,000 employees based in Queens, all I want to say is thank you. You folks were there every step of the way. In order for our people to get back to work and to be safe, protected, we need places like you. Too suffered the travails of COVID and recovered. But at the end of the day, I knew a lot of folks that did not. If I have one thing to ask, and it's kind of a good stuff, to thank our first responders, but you folks were there, and we will never forget that. As one of the largest employers in the healthcare field in Queens County, my hat is off to each and every one of you. And I'm proud to be a New Yorker, and I'm proud to be a Queens resident and a Queens business guy. And just wanted to say thank you very much on behalf of all of our members.
Thank you very much. Thank you. Our next speaker is Carlos Cortez, the Community Advisory Board, or CAB Chair at Elmhurst Hospital.
Hi, good evening. Thank you for this opportunity to speak to the board. Good evening again, Mr. Chairman, Dr. Katz, distinguished HHC board directors and guests. I'm Carlos Cortez, the chairperson of the Elmhurst CAB. I'm honored to come before you on behalf of the CAB members to present the important work that Elmhurst has done in the past year as it implements the hospital's strategic plan. First, I want to thank all of the Elmhurst Hospital doctors, nurses, administrators, and support staff, the housekeeping team, and so many others for all their life-saving work during the COVID-19 pandemic. As a resident of Jackson Heights and consumer of Elmhurst Hospital services for the past 41 years, I'm enormously proud to have such dedicated people taking care of us during this healthcare crisis. Words will never adequately express how much our communities appreciate your sacrifices, dedication, and commitment. I've said these words before many times, and I continue saying them. A thank you will not suffice, but thank you again. Over the past several months, a multidisciplinary team composed of Elmhurst clinical, labor, nursing, and administrative leaders, including myself from the CAB, have come together to further develop and enhance Elmhurst's strategic plan to recover from the impact of COVID and build a better future. The strategic plan incorporates community and staff needs assessments formulated during our leadership retreats and from various focus group sessions. Today, I report on some of the significant accomplishments attained as a result of the plan's implementation, a plan that I'm confident will yield ongoing positive results. Elmhurst Hospital's catchment area has a high incidence of persons suffering from heart disease and strokes. Hospital works diligently to educate its patients about the link between these diseases and the mitigating factors of a diet, nutrition, and exercise. The hospital's program emphasizes physician-patient partnerships that prioritize blood pressure control and encourages patients to plan an active role in their health maintenance. It is a pleasure to report that these efforts are successful and are recognized nationally. For several years in a row, the cerebrovascular stroke program at NYC HHC Elmhurst has been awarded the American Heart Association's and the American Stroke Association's Get With the Guidelines Stroke Gold Plus Award. Due to the hospital's use of evidence-based tools to track and measure success in treating and improving patient outcomes, the Joint Commission certified Elmhurst as a primary stroke center. Moreover, the hospital's administration is developing plans in the very near future to become a comprehensive stroke center, a resource that is much needed here in Queens. We moved closer to this goal last October when Elmhurst acquired, through the generous support of the New York City Council and the Queensborough President, a biplane imaging unit, which allows faster life-saving diagnosis and treatment of stroke patients. Elmhurst also received a well-deserved honor when it was nationally recognized by the U.S. News World Report for 2020-2021 as one of America's top hospitals for the treatment of COPD and heart failure patients. For national ranking in a specialty, a hospital must provide exceptional care for the sickest, most medically complex patients, which we know Elmhurst excels at given our patient population. Similarly, the hospital's nursing team is moving forward to achieve a Pathway to Excellence designation from the American Nurses Credentialing Center. The Pathway to Excellence program recognizes facilities that create positive practice environments for nursing. I'm extremely proud of our doctors, nurses, and extended care team whose deep commitment and work make these and many more achievements possible. I conclude my highlights in highlighting a tremendous achievement given the healthcare industry's current financial landscape. Under the leadership of Chief Executive Officer Helen Arteaga Landaverde, the hospital continues to yield a financial margin that enables it to meet its mission of caring for a diverse yet underserved community. For fiscal year to date, March 2021, Elmhurst underspent its budget target by $18 million, with $10 million coming from a budget surplus in expense and $8 million in revenue. This financial achievement places Elmhurst on track to meet its 5-year target of $100 million in annual operational savings and revenue growth. These are only some of the accomplishments that make me proud to call myself an Elmhurst Care team member. I'm hopeful that we can count on New York City Health and Hospitals to support the high-quality services that Elmhurst provides to our communities. Ms. Arteaga Landaverde, Medical Director Dr. Jasmine Marshipur, Chief Nursing Officer Joanne Gull, and the rest of the hospital leadership and staff are committed to our immensely diverse communities, which greatly need and deserve the outstanding medical care that the hospital has provided over the many years. Thank you very much.
Thank you very much for your comments. Our next speaker is Carolyn Brown. She's the first vice chair of the Queens Hospital CAB.
Good evening. I'm Carolyn Brown. I'm also the Executive Secretary of Queens Community Board 8. I very much appreciate this opportunity to address members of New York City Health and Hospitals, local elected officials and their representatives, community leaders, and fellow CAB members, all of whom share a concern for the future progress of New York City Hospital Queens and the entire public hospital system. The whole borough of Queens, the entire public hospital system, and all of New York City are extremely went one of the most challenging chapters in our history. COVID-19 pandemic has taken its toll. Now, as we enter a period of recovery, we can reflect on our situation and count many blessings and achievements that took place despite the difficult environment we have endured. I'd like to share a very positive story that happened just 2 months ago in our hospital's neonatal intensive care unit. On March 26th, a baby boy named Jaden Wasim Shaw, nearly 4 months old and weighing 6 pounds, went home. At birth, he weighed only 1 pound, 5.5 ounces. March 26th was a very happy day for Jaden and his parents, but it didn't start out that way. Alana Shaw, his mother, said it was a scary experience when she arrived at the hospital in early December in labor at 22 weeks. She found our staff extremely supportive. They took the time to explain everything that was happening to her and her baby. The hospital director of OBGYN, Dr. Alexander Fuchs, and his chief of staff, Dr. Alice Garner, determined the baby's gestational age was pre-viable, but nonetheless, they consulted with one another and committed to doing everything in their power to save the baby. They decided to give Alana an injection of steroids, magnesium sulfate, and antibiotics, explaining everything beforehand to both parents so they were completely informed and understood what was happening. Dr. Fuchs and Dr. Garner had the hospital pediatricians evaluate the baby at the time of delivery and measure his progress. Baby Jaden either survived or he would die. It was an extremely difficult journey, but Jaden survived. His parents came every day to assist his continued growth and development, and after nearly 4 months in the neonatal intensive care unit, Jaden went home at last. Queens Hospital Chief Executive Officer Neil Moore noted that this was the earliest a baby had ever been born at our hospital and survived. Dr. Fuchs said the birth of Jaden was a remarkable team effort and achievement and lauded the entire NICU team as winners. New York City Health and Hospitals Queens was a recent recipient of a B rating from the Leapfrog Group when it released its spring 2021 safety grades. The letter grading from A to F, assigned to general acute hospitals across the country, is the only rating focused on how well hospitals protect patients from preventable errors, accidents, injuries, and infections. For 20 years, the Leapfrog Group has collected, analyzed, and published data on safety and quality in order to push the healthcare industry forward. This year, Queens was one of only 2 public hospitals in the city to score a B grade, as all the others scored lower. In a year that was particularly trying for us, we managed to perform remarkably well in maintaining and sustaining our safety standards. Using Leapfrog as a guide, Queens is the safest hospital in the borough and one of the safest in the city. We commend Dr. Gene Fleischman, who as Director of Quality Assurance for the Department of Medicine has done a great job in upholding these safety standards. Lastly, Queens Hospital recently launched a new website, www.supportqueens.com, that will enable community members to thank the hospital's medical professionals for the work they do to promote the health of patients. The website was launched to coincide with National Nurses Week to emphasize the important role nurses fulfill in keeping patients healthy. We encourage community members to visit the website, post their expressions of gratitude for a job well done, and share their personal stories about the care they received. This is a way of showing support for our fearless doctors, nurses, social workers, technicians, transporters, clerical staff, and everyone involved in patient care. Queens Hospital welcomes messages, artwork, photographs, videos, cards, poems, and drawings that can be shared simply by logging on to this website. We've already received heartwarming messages from elementary school students, Girl Scouts, teachers, caregivers, and hospital employees. We anticipate receiving messages from people in other boroughs and across the country.
Ms.
And we
Brown,
cannot-
your time has expired. Would you mind just wrapping up your remarks? Thank you.
Yes, we cannot express too strongly our appreciation for the magnificent work of all our staff, which led to Queens excelling during this difficult period. And I thank you.
Thank you very much. I've realized that our yellow light is shy this evening and isn't going on, so it's green until it turns red. I'll just gently remind you in the middle of your of speaking if you are still continuing. But thanks so much for your patience. Appreciate it.
Thank you.
Our next speaker is James Bonaparte, the second vice chair of the Queens Hospital CAB. We're waiting just a moment.
Mr. Bonaparte, you're on.
Great.
Hello. Hear me up?
We can hear you. Yes, thank you.
Okay. I was saying that my chair and my first chair, I am the second. I have already spoken about a few things that I had highlighted to say this evening, so I'm gonna be skipping around a little bit. And so, my name is James Bonaparte, and I have been a member of the Community Advisory Board, New York City Health Hospitals, Queens, for the past 7 years. I've also been a regular consumer at the Queens Hospital for many years. Dating back to when I was a teenager. For as long as I can remember, I have thought of Queens as my community hospital and rely on it for most of my health care services. Since joining the CAB, I've been made a commitment to taking on an active role and familiarizing myself with what's going on in our hospital. I currently serve as second chair of the CAB, and I'm also a member of the patient chair committee and participate in the finance, budget, bylaws, and membership committees. My experience is changing. Chairing the patient care committee has encouraged me to assume more active role in advocating for Queens Hospital. This evening, I'd like to talk to you about some of the exciting new projects and developments that are currently taking place in New York City Health Plus Hospitals, Queens. We have recently, as was spoken, Donovan has agreed to give the hospital $5 million toward the acquisition of a replacement linear accelerator machine in the Queens Cancer Center for the purpose of radiation oncology solid mass treatment. The machine that we have now is being utilized to maximum capacity and is near the end of its life. The patient's volume continues to increase significantly. The reliability of the existing 20-year-old machine has presented many challenges, and the acquisition of a new linear accelerator will enable the cancer center to avoid any disruption in the service to its patients. Thanks to the generosity of the borough president, we can expect the arrival of a new linear accelerator in the near future. This new constitutes a major turnaround for the ability of the cancer center to provide optimum care for all its patients. Queens also has been at the forefront of the COVID-19 vaccination distribution and has been actively distributing the vaccine to members of the public and staff alike. Last week, the hospital issued its 50,000th vaccine dose to 12-year-old Timothy Samuels, son of the hospital's pharmacist, Finney Samuels. TJ, as he is effectively known, posed for photographs after his vaccine and made a brief educational video with his father on the importance of protecting yourself from the virus by getting vaccinated. We've also reached a milestone regarding the T building, which many of you may or may not know is an old Triborough building from years back, undergoing a major reconstruction and conversion for the past year and a half. The building is finally ready to transform into 124 newly constructed affordable housing units for low and moderate income residents. The renovation features numerous amenities, including a restored library, computer room, laundry room, gym, children's playground, and a 24-hour front desk. Apartments will be assigned by way of a lottery system in conjunction with the city's Department of Housing, Preservation, and Development. The lottery process will continue until June 16th. The building's transformation creates an optimal environment for finds hospital and healthcare interconnected in one location. The new units will enhance the quality of life on the hospital campus, and people with tenuous health conditions who are able to secure housing in the buildings will now have direct access to the hospital.
Wonderful. Would you
There-
please conclude your remarks?
Okay. Queens Hospital continues to respond to the needs of the community. I understand that our new Chief Executive Officer, Mr. Neil Moore, is working on expanding space and adding more services. The CAB is receiving information regarding active plans to provide involved. Thank you for providing me time concerning Community Advisory Board member and a diligent auxiliary worker, and most importantly, a consumer of Queens Hospital Center.
Great. Thank you
Thank you
very
for
much
the
for your
opportunity
comments.
to address you.
Thank you. Our yellow light is back, I'm glad to say. So our next speaker is Dr. Matthew Kusher, the Clinical Director of Plaza del Sol Health Center. That yellow light will start after 3 minutes. Thank you.
Good evening. My name is Dr. Matthew Kusher. I am the Clinical Director of Plaza del Sol Family Health Center in Corona, Queens. Former home to current Elmhurst CEO, Helen Arteaga Landaverde. Plaza del Sol is in the heart of the pandemic. Elmhurst Hospital is our big brother in this pandemic. We were around, we were open during the height, during when many people fell ill. We have survived just like Elmhurst Hospital has survived. We will continue to grow as Elmhurst Hospital continues to grow. But we must not forget why Corona, Elmhurst, Jackson Heights was the center of this storm. And it's not just because COVID finds minorities. It is because COVID breeded on poverty, breeded on high density, breeded on vulnerable populations, and still does. Just today, I saw a 12-year-old in my health center with COVID that is going to need to be hospitalized, probably at Elmhurst Hospital Center. This is not over, but we must remember the lessons because soon, God willing, this will be over. And the lessons are that health care, that the money we spend on hospitals and on health centers like mine, in part, are better spent on trying to address the socioeconomic reasons and rationales for why this was here in the first place. We need to focus on poverty, on air quality, on water quality, on the things that really improve the morbidity and mortality of the lives of the people that we take care of. And remembering that and placing our resources where it needs to be to help people in their impoverished states will help all of us to improve the healthcare outcomes for which the United States lags behind other industrialized nations, despite the fact us bragging about having the best healthcare in the world. And we don't, because at the end of the day, we cannot address the root causes of poverty that afflict the communities that were afflicted with COVID. That is the linkage. And until we do a better job about addressing that, my patients, which are your patients, and your patients, which are my patients, will not see the better health outcomes that we see in neighboring zip codes and wealthier neighborhoods within this city. I thank Elmhurst for their efforts to help our community take care of the patients and make sure we can do our best. But our efforts will always fall short unless we can address the root causes of why this pandemic hit us so hard. Thank you so much for all your efforts. I appreciate your time.
Thank you so much for your comments. Our next speaker is Ada Gonzalez-Jamin, the CAB member at Elmhurst Hospital.
Good evening to you all. First and foremost, I want to tell you that perhaps I would not be here today if it were not of the superb, caring, and timely services I have received from Elmhurst Hospital this year. I had spent 10 months of grueling seclusion in a place outside of the city where I had been taken to kidnapped by my children to protect me from COVID-19. In January, I received a call from Elmhurst Hospital to inform me that I was eligible for vaccine because I was a patient of the senior care clinic. Jumping out of joy,
Excuse me, I'm so sorry to interrupt you. We're having a little bit of, we're having a little technical challenge hearing you. It goes in and out just a bit. Should we make a suggestion? Can I just suggest, try turning off your video? Sometimes that will improve the audio quality in my experience. Is that possible? Okay, Ms. Gonzalez-Jamin, we can't hear you now. I think what we should do, I think we're going to go, I'm so sorry to interrupt you. We're going to go on to the next speaker and we'll come back to you and you can complete your full statement. Very sorry. Okay, our next speaker is, yeah, we're having some difficulty hearing you, some technical difficulties, I think. And so we were going to move on to the next speaker so that we could try to correct them. Do you want to try right now? You want to try turning off your video and maybe we might be able to hear your audio a little better?
Okay, I'm gonna turn off and come back.
Okay. Okay, do you want to begin speaking now? Okay, we see you again. We're gonna go on to the next speaker, but we can come back to you. Let's just work on the technical details. Is there a number to call you want to call the 788? Call 788-3359, and we'll try to work with you to get the audio sound a bit better. And in the meantime, we're going to move on to Malika Carteron, a cab member with Queens Hospital.
Good evening, and thank you for allowing me this time this evening. First and foremost, Anthony Andrews and the board would like to thank CEO Neil Moore for his leadership and his vision, and we have enjoyed working with him, and we look forward to continuing to work with him on all future endeavors. My remarks this evening will focus on New York City Health and Hospitals Queens' response to the COVID-19 pandemic. I am thankful and proud to say that Queens Hospital and the entire health and hospital system has been leaders in addressing racial inequities with respect to the COVID-19 pandemic, and this is paramount in moving forward as a city, nation, and global community. During Black History Month, the hospital conducted a virtual panel entitled Black Families on the Front Lines of Vulnerability. This discussion centered around treating COVID-19 and the lethal conditions of racial inequities. Racial inequities are embedded in all fabrics of the elements in society. The key group of hospital leadership members were assembled to participate on the panel were Andrew Campbell, Regional Chief Human Resources Director, Tricia Roberts, Chief Financial Officer, Dave Holston, MD, Director of Emergency Medicine, Jean-Bernard Pollard, MD, Deputy Medical Director, and Linda Boulain, RN, Research Nurse Manager. The panel facilitated a frank, sincere conversation about racial inequity. There was a stark acknowledgement of the fact that Black families have been disproportionately losing their lives to the coronavirus. And the racial inequity is the most lethal pre-existing condition that positions people of color to disproportionately fall prey to the virus. The group discussed the fact that the hospital's diversity of both its staff and patient population has placed it in a better position to address this problem. The values we bring to our patient population is that because our borough was one of the hardest hit, as so many have said, the epicenter of the epicenter. We are in the forefront to receive potential cures. In fact, at the height of the pandemic, Queens was one of the only hospitals locally where patients had access to the drug remdesivir to treat COVID-19 and was available to us even before the President of the United States. By practicing a philosophy of equity, we are directly addressing the issues of inequity in the way in which we treat our patients. In this respect, both Queens Hospital and the entire health and hospital system are tackling the inequity issue as true leaders, not just with words or slogans, but with actions. Queens Hospital embodies this mission in its day-to-day action and how we collectively serve our patients and community. Another challenge facing us at this time is the fact that we are witnessing a shrinking number of Black men who are becoming medical doctors. A recent documentary, Black Men in White Coats, was made available to health and hospital staff. The documentary examined the need for more Black physicians in America, dissected the systemic barriers preventing Black men from becoming medical doctors and the consequences for society at large. The documentary focused on demolishing the false stereotypes of Black men in the United States. It explored the reasons why there are so few Black male doctors and the implications of this tragedy. It was created to provide inspiration and hope to our youth and their families. After the screening of the film, a group of Black male physicians who are part of the health and hospital system participated in a very timely panel discussion. Among the topics covered were questions such as, why have fewer Black men applied to medical school in 2014 than in 1978? What challenges do our Black boys face? Who are their role models? Why is it easier to visualize a Black man in an orange jumpsuit than in a white coat? And what's happening in society that more Black women are becoming doctors while Black men are stagnant? This is evident in the medical field and other industries as well. I encourage everyone to look at the film, and you can find it at www.blackmeninwhitecoats.org. Again, that's www.blackmeninwhitecoats.org. Thank you for your time this evening. Be well, be safe, take care.
Great, thank you very much. Our next speaker is Emmanuel Valverde, manager at Target.
Do you guys hear me?
Yes.
Yes.
Yes, perfect. Yes, so nice to meet everybody. I'm actually the store director for the new Jackson Heights store, which is a block away from the hospital itself. We've successfully opened the store about a month and a half ago. My partners at Elmhurst Hospital and I, we've been working together for about 2 years now. And it's been really exciting working with Atia and Rochelle, and working alongside with them, and also just an honor to be able to help our community, being that we recently moved in. We've been really excited to show that we as a company, and also a neighborhood store now, can be a vital part of the community. And thank you to Elmhurst Hospital. I just want to give them recognition. The store team has had the opportunity to volunteer in many events throughout the year, both pre and post COVID. And we actually have a few events that we're participating in coming soon. So, thank you to them who've given us the opportunity to be able to be part of that. We've also not only been able to extend our volunteer hours, but a few donations and some small financial assistance via gift cards to families that have really needed it in the community. And we're super happy to be able to help our home community. And as they said, as one of the speakers said earlier, it's really important for us that the neighborhood knows that they're important to us as well. When opening the store, we were extremely happy to have gotten really many applicants from around the neighborhood, and able to offer them employment, and some of those being friends and families and patients of Elmhurst Hospital. So that's been really nice. That was a nice turnout. And then I'd also like to thank Elmhurst Hospital, Atia and Rochelle, because they've been keeping an open line of communication with us and allowing our team members to do walk-ins recently to get their COVID shots. And we are big supporters as the company. We're big supporters of the vaccine, and we want to make sure our frontline workers, our employees, are able to be protected from COVID, being that they've worked throughout the entire pandemic, and are continually employed. Also, just a fun fact, I'm also from the area. I grew up. Elmhurst Hospital is my childhood hospital, and my daughter, who is now 13, was born at Elmhurst Hospital. So it's been a really nice time, and just thank you again for inviting me to be able to be part of this. So Elmhurst Hospital is really near and dear to my heart, and my family as well. So thank you, guys.
Thanks so much for your comments. Happy to say that I think we have fixed the technology problem. So we're going to go back to Ada Gonzalez-Jamin, the CAB member from Elmhurst Hospital. If you want to continue with your statement.
Thank you.
Great. We hear you much better.
Thank you. As I was saying, I was extremely happy when I got a call from Elmhurst Hospital to inform me that I was eligible for a COVID vaccine because I was a patient of the senior care clinic. Jumping out of joy and lining up with hundreds of other happy seniors, I took the 2 shots of the Moderna vaccine. It was an awesome and well-organized campaign. And like them, I felt that my life and my sanity were being returned to me. Thank you, New York City Health and Hospitals, and thank you, Elmhurst Hospital. My entire family thanks you. My name is Aida Gonzalez Jaring. I am the chair of the Community Advisory Board's Legislative Committee. I want to say also how grateful our community has been to Elmhurst as it has cared for us during the pandemic. I appreciate the heroism and dedication of the Elmhurst staff, and I will continue to do all I can to champion their work and as we get through this difficult period in our history. The COVID-19 pandemic has served as a stark reminder of the vast inequalities within our society when it comes to race and social justice, and how these inequalities play out in relation to our healthcare and our healthcare system. Now more than ever, I would hope that safety net hospitals like Elmhurst, which serve diverse populations of color, immigrants, and the poor, will receive the resources they need to help to eliminate discrepancies that may be putting people's lives at risk. Now, this past February, our CAB hosted a virtual panel of elected officials to hear a presentation from hospital clinicians about much needed infrastructure projects. We heard excellent presentations from Elmhurst's new CEO, Helen Artiaga Landaverde, and from our medical department chiefs about the critical need Elmhurst has to receive funding for modernized and upgraded equipment. I am pleased to report that New York City Health and Hospitals and Elmhurst have received funding, 5.5 million from Queensboro President Donovan Richards to support the renovation of intensive care units operating suites at Elmhurst. I want to thank our City Council members, Daniel John and Francisco Moya, Assembly Member Catalina Cruz, and Federal Representatives Grace Meng and Alexandria Ocasio-Cortez for their pledge to allocate funds to reconstruct major parts of the hospital. I also want to thank Assembly Member Jeff Aubrey for sponsoring Elmhurst with a state grant to begin a mobile vaccination program. Doing this type of grassroots outreach and health education will be of great benefit to the community as the hospital seeks new ways to meet healthcare needs in our neighborhoods. As Dr. Matthew explained, there are many needs in our community, and I would like to add education, health education, a basic need in our community. Last, I want to thank all of the elected officials at the federal, state, and local levels who have worked tirelessly to support Elmhurst during this unprecedented COVID-19 pandemic by connecting the hospital to donors who generously
Okay, I'm afraid that we're losing. Yeah, I'm so sorry. We're losing we're losing your connection again. So we're going to ask you this time. I think we heard everything till this point. Hi. Thank you. We're going to move on to the next speaker. We can't hear you so well now, but if you can submit the rest of your testimony, we'll make sure the board hears it. Okay. Thank you very much. Thank you. Okay, our next speaker is Leslie Ramos, the Executive Director of the 82nd Street Partnership.
Good evening. My name is Les. Can you see me and hear me? I just want to make sure things are working properly. Okay. Thank you so much for the opportunity to speak tonight. My name is Leslie Ramos, and I represent the 82nd Street Partnership. We are a business improvement district located just like maybe 2 buildings away from Elmhurst Hospital. So Elmhurst is our go-to facilities for any advice on how to help the community. Many of our businesses were impacted during COVID. We know that COVID was not only a healthcare crisis, it was also a economic crisis. In order for us to help our community recover, we need a strong healthcare system. And for that means outreach, for that means education. Elmhurst have always been exceptional in that part. I am very pleased to have been working with them pre-COVID in doing educational programs ranging from cooking classes to high blood pressure taking, and now I'm going to say post-COVID, hopefully we're there, but now making sure that our workers and our businesses are getting their vaccines. We know that in order to increase the safety of our community, to make sure that our shops, our employment returns to our community, that those that work, especially in our restaurants, in our grocery stores and deli, are very aware of the services that the hospital offer and are aware of free vaccinations and testing. So I'm very grateful that Elmhurst Hospital has started doing direct outreach to our businesses. I've been kind of snooping on them when I ask them if they're not vaccinated. I would ask the hospital to please reach out to them, and the response is always quickly, yes, we will be there. As we move forward in the city, we know we work in a mostly immigrant community. Many of our neighbors, many of our workers don't have access to healthcare or free healthcare or low-cost healthcare. And these are the type of issues that I can bring to the staff, especially to the community affairs department. Like, I found out that one of our businesses didn't have healthcare, and today immediately I got a text back with information from the hospital. Here's our resource. Here is what we offer for those that cannot qualify for insurance in other ways or cannot afford insurance. These are services that are critical for a healthy community, and I have to say, for a healthy, strong economically community. During the pandemic, not only did we see long lines at the hospital, we saw long lines of people looking for food in our community. So in order for the city to recover, we know that we need to have people back to work. So I love Elmhurst Hospital. I've seen how they had been partner in how they truly care, how they shift their work to accommodate the culture of the community. That is something that's condemnable, that is something that is admirable, and I hope that it continues in the near future. I'm very glad to see that our elected officials have provided funding. I'm hoping that the city can match those funding because they're essential in our community. So thank you so much for having me tonight, and I look forward to seeing everyone in person soon.
Great, thank you so much for your comments. Our next speaker is Michael Hurwitz, Director of Grow NYC at the Elmhurst Green Market.
Hi, good evening. Can you see me and hear me? Great. Well, thanks so much for having me tonight and for welcoming back the Grow NYC Green Market at Elmhurst Hospital for its 12th season. The last 4 speakers and many speakers before that talked about issues of equity, issues of addressing root causes of health discrepancy. And our market is an example of Elmhurst Hospital's commitment to this community in addressing just those issues, from ensuring that health and wellness begins with what is available, with what we're putting in our bodies, knowing that food that is harvested within 24 hours is the most nutritious, is the most healthful products we can eat. And also working with us, we have piloted national models on affordability, from our pharmacy to farm program to our EWIC program. This year, we will be matching SNAP dollars dollar for dollar, as opposed to in previous years, $2 for every $5 spent. So again, boosting buying power and ensuring that all New Yorkers have access to these products. I remember sitting almost 13 years ago with Councilmember Drum, talking about making this happen, and with the support of the hospital, Tia Butler, her incredible team, this will be our 12th season, and we're super excited to be coming back. As a reminder, I live right down the street, and I am in awe of the hospital. I know the year that you have been through and what you've accomplished. It's monumental. My children have both been seen there, and my oldest was just vaccinated there. So thank you so much. Super excited to see everybody at Market, and take good care.
Great, thanks so much for your comments. Our next speaker is great. We are going back to the beginning of our list. Councilmember Daniel Drum is now with us. He is a New York City council member from District 25. Councilmember Drum. Councilmember, are you on? No. Okay, we'll come back again. Next speaker is Tamara Michelle, a health and wellness specialist at the Queens Public Library.
Good evening. Thank you so much for the opportunity to say a few words about our partnership with Health and Hospitals, which began about 15 years ago with Queens Cancer Center. And we continue to deliver regular programming with Linda Bulone, their absolutely incredible research nurse manager. Most recently, she had delivered education on COVID-19 to the public, as well as our Queens Public Library staff. And our staff just keep asking to have Linda back to discuss new topics because of the candid but compassionate way that she answers any question posed based in science and data. We also have a very rich partnership with Elmhurst, and I cannot pass up the opportunity to thank Tia Butler, their Director of External Affairs and Marketing, who works tirelessly to bring us fantastic programs with the support of her exceptional team. I also want to thank Tia for her participation in our recent virtual 24-hour Black Health and Healing Summit, where she served as one of our Careers in Healthcare panelists. Our partnership with Elmhurst started in 2016, and they continue to provide exceptional health education through the Queens Public Libraries. H&H providers are professional, thoughtful, and as a result, their programming for our customers is excellent. Prior to the pandemic, providers with various specialties delivered programs throughout the borough at community libraries so that Queens residents could access the information right in their own neighborhoods and in their preferred languages. And from the start of the pandemic, programming for library staff has continued to reach wide audiences virtually via WebEx and Instagram. We are always eager to broaden and expand our partnership with H&H, so I'm excited to share with you that our latest work together, called QPL Baby, will allow babies born at Elmhurst to receive their very first library card, complete with resources for new parents, and we hope to roll that program out soon. So on behalf of Queens Public Library, thank you so much, Elmhurst and Queens Hospital, for your commitment and for continuing to take the best care of us.
Great, thank you so much for your comments. Our next speaker is Yoselin Hinoa Estrella, and again, please correct me if I pronounced it incorrectly. Executive Director of Neighborhood Housing Services.
Hello, everybody. So Yoselin couldn't join as she had something pop up at the last minute, but my name is Alex. I work with Yoselin over at NHS for Queens. So we want to thank you for the time and everybody for sharing their thoughts, especially for our communities here in Queens, especially Elmhurst. As we all know, no surprise, Elmhurst got hit the hardest last year through the pandemic. NHS of Queens is housing, a HUD housing counseling agency here located in Woodside. We have been serving the communities for over 26 years, and especially communities like Jackson Heights, Corona, East Elmhurst, and Elmhurst itself. So pre-COVID, I mean, we've always had a strong relationship with Elmhurst Hospital. Pre-COVID, we'd work with Elmhurst Hospital and providing the patients and staff members with various housing, counseling, and education. As we all know, housing and a house are interrelated. Housing, having good homes, safe and good homes for our communities are usually correlated with good physical and mental health. And the contrast, when you have poor quality and inadequate housing, that usually contributes to health problems such as chronic disease and injuries, especially in our communities that are often low income and communities of color and always prone to these chronic diseases and injuries. So for us, NHS of Queens, we've been working, like over the past year, providing our usual services from first-time home buyer information to tenant assistance to, as somebody had mentioned before, one of the biggest things that arose last year in our communities was the food insecurity, and we began a food assistance program called the Adopt a Family Initiative, in which we provided 2-week grocery supplies to families, and we would deliver them to their homes so they didn't have to go outside and be exposed. So last year we were able to do programs like that in which we served 147 families. And as we are weathering and coming out of this pandemic, we look forward to continuing to work with Elmhurst Hospital, and hopefully Elmhurst Hospital also considers working with organizations like us, and also possibly funding organizations like NHS of Queens, which are currently expanding from their usual services and doing things that the community really needs, especially like right now as well. Like I said, the food insecurity, and also most recently, the 89th Street fire, which left many of our neighbors without a home. So as we move forward, we hope that we're able to continue with the relationship with Elmhurst Hospital to be able to ensure that New Yorkers and the members of our community have healthy and safe homes in order to promote that good physical and mental health. Thank you very much for all your time.
Great, thank you so much for your comments and for stepping in. The next speaker is Taj Rajkumar, a CAB member at Elmhurst Hospital.
Can you hear me?
Yes.
Okay.
Yes.
Good evening, everyone. My name is Dr. Taj Rajkumar. I'm a professor at the City University of New York. I'm also a member of Elmhurst Community Advisory Board. Thank you for the opportunity to speak today about Elmhurst. Excuse me. I'm originally from Guyana. I am active in the Guyanese community in Queens, and have served as a district leader representing Assembly District 31. I work very closely with our locally elected officials to improve quality of life issues for the people of Queens. I decided to join Elmhurst Community Advisory Board because I recognize how fundamental having access to good health care is to the well-being of our communities. I also wanted to learn more about how Elmhurst is working to improve patient care and the patient experience at this facility. Elmhurst, as you're aware, has started its journey to be certified in excellence in person-centered care by Plaintree. As you might be aware, Plaintree partners with healthcare systems across the globe to provide a construct for person-centered excellence. This construct is a proven process that leads to better care, better outcomes, better talent, and organizational culture focused on putting patients and their loved ones first. A multidisciplinary steering committee, including patients and the Elmhurst Community Advisory Board, has been established to provide guidance and review improvement initiatives as well. The Caring Connections program that you have heard was established during the first wave of COVID-19, allowing Elmhurst to connect patients with their loved ones via video calls during the lockdown. Elmhurst received many letters from patients' family members thanking the staff for connecting them with their admitted loved ones, while access to the hospital was restricted or when they could not come to the hospital due to their geographic location. Elmhurst decided to continue this program to allow all patients to connect with their family members via video call whenever in-person visits are not possible. This hospital believes this initiative is really showing how Elmhurst cares about not only their patients but also their family members. The hospital's ambulatory care team also continues to make healthcare more accessible through video and telehealth visits. In addition, Elmhurst has continued to follow enhanced safety procedures. All patients must wear face masks or face coverings at all times. All staff are required to wear appropriate PPE while treating patients. All patients and visitors at entrances to clinics are met with temperature check. And clinic windows now have clear protective barriers and social distancing is maintained at all times. Elmhurst continues to pre-register patients before appointments through phone calls or contacts made by ambulatory care team members and staggering clinic times to avoid crowded waiting areas. Rooms are also cleaned and sanitized frequently throughout the day and in between patients. Elmhurst has expanded the number of negative pressure rooms in its clinics to control the spread of pathogens. I'm happy to see the efforts that Elmhurst is making to improve patient satisfaction and ensure that care is being delivered in compassionate ways. I look forward to learning more about these efforts in the future and working closely with Elmore's leadership to provide community feedback. Finally, I must applaud the Elmore's family under the astute leadership of CEO Helen Artiega for the distinguished and remarkable healthcare they are providing to every member of our community. Thank you, ladies and gentlemen, for your time.
Great, thank you so much for your comments. Our next speaker is Maria Fierro, cab member at Elmhurst Hospital.
Good evening. My name is Maria Fierro, and I'm an honor in being part of the advisory board. I wanted to share the reason I am part of the board is because Elmhurst Hospital is a place that brings hope. I see how my community has been treated with compassion and dignity. One of the things that I admire from the leadership of the Elmhurst Hospital is that they're always looking to bring the best health system, always looking for ways to be better. So it's a journey. It's never, and the best is not enough. They're always looking for new ways. So I'm very proud and honored to be part of the CAP. And then, as we all know, we had to face the COVID-19 pandemic, and definitely Elmhurst was in the center of the global crisis. Like many of you have heard, we saw the lines, so many people that didn't have hope or didn't know where to go, and Elmhurst was the place to go. I do have to say, last year, Elmhurst underwent enormous reorganization to meet those needs. Again, showing their leadership and seeing how they actually created new intensive care units, supply chains throughout the hospital, and implemented one of the most well-organized physician vaccinated and testing program in the country. Again, they have been, now that we're kind of in the second phase, and everybody needs the education to get vaccinated. Besides being a CAP member, I was a patient. I had a lot of concerns and questions about vaccination. They answered my questions, and I'm happy to say that I'm part of 53,000 people that have been vaccinated at Elmhurst Hospital. Besides 100,000 people have been able to get tested, COVID tested. The other great news is that the hospital is open since March 1920, 7 days for anyone who needs COVID testing. In order to accommodate community demands for testing, the hospital relocated to a new renovated space where COVID PCR testing and COVID antibody testing is provided on a walking basis. Vaccines open for the community on January 4th, 2021. Elmer has 2 locations for the convenience of the patients. The first dose vaccinated takes place in the Annex O building on 40 Street, 40, I'm sorry, on 41 Avenue. And second, the second doses takes place in the main building on the first floor, and vaccinations are available Monday through Saturday. And again, I have to say thank you. I was very nervous, and everybody was, again, compassionate, caring. And actually, I have to confess, the nurse held my hand until the whole process was done. So thank you, Elmer's. Elmer's currently has a capacity to allow walking and vaccinated appointments of the Pfizer vaccine to anyone aged 12 and older. Elmer's is also working hard to reach out to the community to making testing and vaccinating even more accessible and educate many people as possible for the benefit of COVID-19 vaccine. Throughout the pandemic, Elmer's has collaborated with several organizations in our community to get tested. Some of those organizations are Voces Latina, Make the Road New York, NICE, and the 82nd Street Partnership, as well as faith-based organizations. In addition, Elmer will host 2 upcoming events aiming promoting vaccinated to children and young people ages 12 and 21, including a virtual teen town hall on June 6th at 6 p.m. and a teen health fair at the hospital sponsored by Metro Class Health Plan on June 19th from 10 to 3 p.m. I continue to be inspired by the healthcare team of Elmer's under the leadership of Helen Arteaga Landaverse, Dr. Mashapur, Wayne Zimmerman, Joe Gale, and the tremendous team of over 4,000 dedicated people who work at Elmer's. I appreciate how they have worked and care for our community as we battle the pandemic. I hope to see the hospital continue to be strong supported by health and hospitals and our local effective official as it goes about the work of healing of us. The healing us from the after effects of a terrible plague and move forward to a better, healthy future for our patients and family. Thank you very much.
Great, thanks so much for your comments. Our next speaker is Leah Salmoran, president and founder of Paddle for the Cure, New York City. Leah Salmoran. Okay, we'll come back if we see that you are on, but in the meantime, we're gonna move on to the next speaker, Kimberly Headley, COO of Strong Power Consulting. Kimberly Headley. Okay.
Hello?
Move on.
I'm here.
Oh, yes.
Hello? Yeah,
Is
no, I
that
was trying to
Kimberly?
unmute. I'm sorry.
Okay.
Yes, how are
Terrific.
you? I just
Good.
want to take the opportunity to thank Dr. Andrews and President Neil Moore for the ability to speak briefly on the work that Strong Power is doing in the community. We have just introduced a partnership to Queens Hospital with Spence Chapin, a 100-year-old adoption agency who's looking to bring free resources to individuals and families who are looking to adopt. They're advocates for healthy adoption programs and services. They do counseling with social workers. They've worked with other hospitals, both private and public in the city. And we want to introduce them along with other community partners to Queens Hospital and any other hospitals in Queens that would be interested in our services. One of the things that COVID-19 has taught us all is that we're each other's brothers, sisters, and keepers. That means that since it hit everybody from every walk of life, every color, gender, sexual persuasion, we know that in order for there to be positive outcomes for our people, the people who we are servicing in these hospitals and community health centers need to be stakeholders. One of our stakeholder partners in the community is Health First. Health First is working with us to do what we call chronic disease self-management program courses and diabetes self-management program courses. And these courses are designed to help those who are living with diabetes, pre-diabetic, caregivers to those with diabetes, to sit in a 6-week course free of charge. They provide books, and this is through Stanford University in California. And we've been working with them in the community to bring health management and wellness plans to those who are suffering from diabetes. That is a very passionate part of our work in the community. And we're looking to partner with Mr. Moore and the staff at Queens Hospital. If Elmhurst is interested, if you do not have a similar program, we would love the opportunity to bring that. We, during the pandemic, have worked with Joseph Adabo Health Center in Far Rockaway when they were out of PPE equipment. And we worked with another organization, Zuchi Foundation, to bring PPE equipment. So our goal is to find those partners who have free resources, whether it's providing employment for those. We work with York College, and we're interested in working with hospitals. Perhaps you need more social work support. How can your college and other colleges in Queens work with the hospitals to train interns to learn this work? Because we know that the pandemic has caused many people to either to retire, and sadly they lost their lives, the frontline workers. So how are we turning over the employment rate of those and employment success of those who are entering and exiting their college programs to begin to work in the hospital system, the community health and public hospital system? So I'm just thankful for the opportunity to share, and I look forward to working very closely with Health and Hospitals Corporation and, more importantly, Queens Hospital. Thank you.
Great. Thank you so much for your comments. Next speaker, Kevin Livingston, president of 100 Suits. Okay, Kevin Livingston? Nope. Okay. Diane Thompson, development manager at Afro Latin Jazz Alliance. Diane Thompson. Okay, we're gonna keep moving down the list. Tiffany Price, a project manager at Dunn Development Corporation. Tiffany Price.
Hi, everyone. Hope you can hear me.
Great. Yes.
Hi. So thanks again. Thanks for having me. Again, my name is Tiffany Price, and I am a project manager and speaking on behalf of Dunn Development Corp this evening. And so I wanted to talk to you a little bit more about the T building that was located formerly on the corner of the Queens Hospital Center campus that James spoke a bit about before. So Dunn Development Corp, we're a developer of affordable and supportive housing, and we work throughout New York City. We've been working for the past 20 years. And Dunn Development Corp has been partnering with health and hospitals, specifically the Queens Hospital Center campus, on the redevelopment of the T building. And that's located at 8241 Parsons Boulevard in Jamaica. So since 2014, Dunn Development Corp has been working closely with health and hospitals, as well as the New York City Department of Housing Preservation and Development, local elected officials, and many community members on a vision to transform this former tuberculosis hospital and later an outpatient clinic for the hospital into a fully restored mixed-use property to provide much-needed affordable housing for the neighborhood and for the city. So the T building, it's a 10-story building, as you can see behind me, a beautiful historic gem. And so our redevelopment plan is allowing it to contain 200 low and moderate income apartments. There's also residential amenities, and there's going to be 20,000 square feet of community facility space. So for the residential portion of the building, it's going to house a mix of studios, 1, 2, and 3 bedroom units. And the amenities include a 24-hour staffed front desk. There's elevators, community rooms, outdoor terraces. There's a playground. We have laundry on site. We have an exercise room. We have balconies for some of our units, parking spaces for some of our units. The whole building will be outfitted with high-speed internet, both in the residential units and in the common areas. And then we also have an on-site support services suite that'll be available to all of our tenants, but specifically for the 75 units of supportive housing that we have. And so those 75 the 75 units, there will be supportive housing for single adults. And there's going to be a preference for those who are referred from health and hospitals. So we've been working really closely with Leora and Majory in terms of getting the process together with HRA to make sure that we are finding people that are, from the system, hopefully nearby, definitely utilizers of health and hospitals. And so that'll be 75 of the units, and then the other 124 units, not including our super that will be living on site, the other 124 units, those will be going through the city's housing lottery process. And that lottery is open right now. It closes on June 16th. We really encourage everyone to tell a friend, tell a neighbor. The units are really great. I just gave a tour today. We actually walked CEO Neil Moore. We walked him and a couple other HHC staff members through a few weeks ago, and really excited about the progress. Back to the building, the other 20,000 square feet that's on the ground floor of community facility space that I mentioned, it's going to be broken out into 12,000 of the 12,000 square feet is going to be leased back to HHC. And so that will be for a future use of your choosing. And another about 8,000 square feet, that is another community facility use that we hope will be a community center. So we don't have the tenant identified just yet, but happy to looking for all our alternatives and happy to hear if you guys have suggestions. So just to let you know about the current status of the building. So throughout the building's development, we got the T building listed on the New York State and the National Register of Historic Places to highlight the 80-year-old building as a historic gem. In July of 2019, Done Development and the contractor on the project is Mega Contracting Group, began construction of the site. So it is a gut rehab. We've removed pretty much everything besides the floor plates and the stairs. That said, we have opted to save a lot of things because it is a historic rehab. So we're restoring the facade of the building, the front entrance, the granite, the marble, a lot of the light fixtures, the lobby with all of its marble, our tiled staircases, and we're restoring a few spaces that we found, the historic spaces that we found through Library of Congress pictures. So the historic auditorium on the 9th floor, the library on the 1st floor, in addition to preserving the terraces that are on the 8th and 9th floors. Also, in terms of the preservation, we're keeping, if you guys are familiar with the building or to walk through that hospital, the 10-foot corridors, we're preserving that width. We're keeping a lot of the ceiling heights. So ceiling heights in apartments are going to be 10 feet, 11 feet high, which is pretty impressive.
You've reached the end of your time. Would you conclude your remarks, please?
Yeah, no problem. So again, just please, just encouraging everyone to check out the lottery. NYC Housing Connect has the posting, and we encourage you to share it widely. Thank you so much to Health and Hospital staff, especially our Queens Hospital Center staff, and thank you to everyone.
Thank you, Tiffany.
Great. Thank you so much.
Thank you.
Thank you. Our next speaker is John Boyd Jr., a pastor with New Greater Bethel Ministries. John Boyd Jr. Okay. Just a moment. He is on. John Boyd Jr., if you're on, if you could please unmute yourself. We can't hear you. Dial *6. *6. Okay, we're going to go on to the next speaker, and I'll come back one more time when we're finished and see if anybody else is available or is able to get on. The next speaker is Monica Baker, the Director of Domestic and Special Needs Adoption for Spence Chapin Services to Families and Children.
Hello, good evening, everyone. Thank you for the opportunity to speak with you all tonight. My name is Monica Baker, and I'm the Director of Domestic and Special Needs Adoption at Spence Chapin Services to Families and Children. We are an agency, an adoption agency that's been around in the New York City area for over 100 years. I think I just want to start with saying that we do so much more than adoption, and we really work with women and families who are experiencing an unplanned or a crisis pregnancy, and are really maybe ambivalent about parenting and exploring their options. And we provide really intensive counseling and support services. All of our services to birth families are free to help them truly explore their options for themselves and for their babies. And we are by no means pressuring anyone or kind of on the side of adoption. We really just want her to be able to receive free counseling and be sure that she's making the right choice for herself in this time of crisis. We have been so lucky to work with the New York City Health and Hospitals in Queens for years, who have been so compassionate with our clients and who have referred many clients to us, mainly the social workers in the mother and baby units or in the NICUs, who are recognizing that a woman is in a position that she's not sure about bringing her baby home. Also recognizing that somebody who has children's services involvement and might not want their child to go into foster care, but would rather make a plan for their child that they have more control over, being able to choose a family who represents the background that she wants her child to be raised in is so important. And we're always sure to provide her with options of all families of all different kinds of backgrounds and for her to choose from. We also offer free temporary care to the infants who the mom might not be ready to bring that child home. And this just gives her a little bit more time to think through her plan and, obviously in the hospitals, there is a short term that the child can stay in the hospital, and the social workers and hospital staff are very eager to be discharging those children who may not have a safe place to go. So Spence Chapin offers a free and safe place for the child to go while the parent maintains her legal rights and can make a permanent plan for the baby. So we are really looking forward to continuing our relationship with New York Health and Hospitals in Queens and continuing to working with the staff there. We offer at Spence Chapin training. Part of what we want to do is there is such a stigma to a woman who is considering different options for her child, and we want to be sure that hospital staff is very just up to date with what her options are and how to work with her as compassionately as possible so that she feels empowered to make the right decisions for herself and for her family. So we're offering free trainings to hospital staff about how to work with women who are experiencing crisis pregnancy, and we offer a wide range of different services and connecting women with services to help them make a parenting plan if that's what they wish. So we just hope to continue providing these trainings. We offer regular trainings that provide free CEU credits, continuing education credits for social workers and nurses, and we have had great turnout at those from the staff at your hospitals, and are, you know, just looking forward to that continued relationship. So thank you for the opportunity to be here, and we just want to thank you know, the social workers at Elmhurst that we've had such a long running relationship with, the social workers at New York Health and Hospitals Queens, Gotham, that have been just so compassionate with our clients who are really, you know, going through such a crisis experience when they're entering the hospital, and you know, delivering their babies with and unsure about their plan. So we are so grateful that you've remembered Spence Chapin and referred your clients to us so that we can really give them some support and connect them with free services. Thank you.
Great. Thanks so much for your comments. I'm just going to go through a couple of the names of people who were unable to get on, and just to see if there's one more opportunity if you're there. Leah Salmoran, Huddle for the Cure.
Hello, good evening, everyone.
Oh, good, you're there.
Sorry, I was disconnected a while ago. So my name is Leah Salmoran. I am a proud breast cancer survivor and founder of Paddle for the Cure NYC, PFC for short. It is a great honor for me that I was given this opportunity to speak tonight and share our PFC vision and its challenges are as charity as in a work in progress. I would also like to thank Helen Archaga Landaverde, CEO of NYC Health Plus Hospital, for inviting me to speak tonight and believing in PFC and making herself available with her team to assist us in reaching our goal to grow our organization. I hold on an utmost respect for Elmhurst Hospital, its works, especially its people who saved my life. Elmhurst Hospital has become my home away from home. PFC is a pioneering in the use of all types of water sports in the whole cancer community in New York City. As a support organization for breast cancer survivor, we offer a unique survivorship program that that presents the ideas about wellness. Especially, we focus in the holistic values and practices, most especially many of which are developed around the sports of dragon boating. Paddling is very therapeutic, according to Dr. Don C. Mackenzie from British Columbia, a sports medicine expert and a paddler himself. Paddling increases flexibility, aerobic capacity, and physical and emotional strength. As according to Dr. Mackenzie, women that paddles improve physical and mental health with no recurrence of lymphedema. Paddling is a team sport that also is fun, builds harmony, and a feeling of togetherness. Water is the crux of our survivor programming, so a clean, safe, thriving, natural environment and safe, stable ecology are important aspects of our work as a whole. I'm happy to say that PFC has developed some supportive partnership to achieve our goal with the NYC Health Plus Hospitals, Elmhurst. PFC is the official team of EHC Dragon Boat Team, Women Enlightening Past Designs NYC, has been instrumental for helping us to grow. The coaching of New York Wall Street Dragons has been helping us to grow the Dragon Boat team and become stronger. Coastal Paddle, they are a group of water people from Florida and Long Island City who has been supporting us all the way. Although we in PFC have great passion and strength, we can't work and expand our 3A's, awareness, action, and advocacy on our own. We hope you will support our holistic and our general wellness program together with our sports activities to benefit the survivors at the Hope Pavilion Cancer Clinic with no cost on their end. We want to help them improve their quality of life after breast cancer. By supporting us, we are creating a united front against this deadly disease. And together, we will create a world without breast cancer. As a voice of the survivors and surpass my 5 lives, being in diabetic coma, 2 car accident, breast cancer, and COVID, rest assured that the heart of our cause are our survivors. We will stick to our promise that we will take care of our survivors the PFC way through the grants and support from the NYC Health Plus hospitals. We will help our survivors and lead them a healthier lifestyle. And together we will build and create a strong EHC Dragon Boat team, a strong, committed, healthy, and aware community. And to learn more about us, to join our Dragon Boat team, just go to our website at www.pfcnyc.org or just email us at info@paddleforthecurenyc.org. Thank you so much.
Great, thank you so much. So again, just in case anybody is on who has called previously, Kevin Livingston. Kevin Livingston. Diane Thompson from the Afro-Latin Jazz Alliance. Diane Thompson. Okay, and finally, we're going to try to go back to John Boyd Jr., pastor with the New Greater Bethel Ministries. You're on.
He's still on mute.
Oh, yes. Oh, no. Okay, yes. We see that you're unmuted. We can't hear you. If I can suggest, you can submit, if you call 212-788-3359 tomorrow, you can send in any written statement and it will be considered by our board. So sorry that we can't hear you this evening. Okay. And with that, I think that it concludes our meeting. Thank you all so much for sharing your views and have a safe evening. Bye-bye.
Thank you. Have a good night. Good night, everybody. Take care.
Good night, everyone. Bye-bye.
Good night.
Excellent hearing.
Good night. Aida Gonzalez says good night.
Good night. Thank you.
Thanks for your comments.